Very much, Mr Speaker. My question is to the Premier. Why are there today significant numbers of unoccupied beds in our major hospitals while many people languish in emergency departments waiting for a bed? And with your leave, sir, and that of the House, I'll explain.
Leave is sought. Is leave granted?
Yes, sir.
Leave is granted. The member for Ghana.
At 2 p.m. today, there was only 719 people occupied beds in the Royal Adelaide Hospital out of 812 beds in that hospital, 93 unoccupied beds. And at the QEH, there was only 310 out of 355 beds occupied, some 45 unoccupied beds, according to the state government health dashboards. At the same time, there were 44 patients in those hospital emergency departments stuck in emergency waiting for a bed. Of those, 15 had been there for over 24 hours waiting.
The Minister for Education.
Thank the member for the question. I thank the member for the question, and there's quite a lot of detail in that, in operational matters, which I'll take on notice. And seek an answer in relation to both the nature of those numbers and the context in which they are provided. And if there is further information that is relevant to that context to the House, then I'll bring that back to the House.
The member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. Does the Premier get advised when a hospital reaches a code yellow internal disaster level, and if not, why not?
The Minister for Education. The member for Mawson will leave for 20 minutes in accordance with Standing Order 137A. The Minister for Education has the call.
Thank you, sir. I thank the member for the question. In relation to the process of what takes place when there is a code yellow, I will seek information about that process and what the protocols are from the Minister for Health and bring back an advice to the House. And in doing so, I also feel like I have an apology to make to the member for Ghana. In a previous question time, I understand that I referred to the member for Ghana as indeed the advisor for Transforming Health, and he took offence at the time, and I apologise for that mistake. On checking the record, it turns out he was indeed the Assistant Minister for Health during the end of the last government.
The Order. The Premier. The member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. Can the Premier explain how a tow truck and the media were able to arrive at the scene of a car crash at Burton on Friday night before an ambulance was able to arrive? And with your leave, sir, and that of the House, I explain.
Leave is sought. Is leave granted?
Yes, sir.
Leave is granted. The member for Ghana.
On Friday night, a tow truck and the media both beat an ambulance to the scene of a car crash of 4 cars pile up at Burton. The ambulance took over an hour to dispatch. A recording from the MFS was revealed saying, quote, "We've got a casualty that's still in the car, awaiting SAS, but we're being told it's an hour wait for SAS."
The Minister for Education.
Thank the member for the question. Obviously, there's a great deal of detail in relation to a specific incident that the member has identified, and we will check those details, and I'll seek further advice from the Minister for Health.
The member for Ghana.
Thank you, sir. My question is to the Premier. Does the Premier think it's acceptable for a schoolgirl with cardiac issues to wait 4 hours for an ambulance? And with your leave, sir, and that of the House, I'll explain.
Leave is sought. Is leave granted?
Yes, sir.
Leave is granted. The member for Ghana.
It was reported by Channel 9 News on Saturday night that on Friday afternoon a schoolgirl was taken to Flinders Medical Centre in an ambulance crew car after staff were told it would take 4 hours for an ambulance to arrive. This schoolgirl had collapsed with heart issues.
The Minister for Education.
I thank the member for the question. Obviously, in relation to any incident where there have been clinical decisions made or any other decisions made, then there's a level of operational to the question. And in that context, and as representing the Minister for Health, I'll seek further advice and bring back an answer for the House.
The member for Ghana.
Thank you, sir. My question is to the Premier. Can the Premier explain why a 93-year-old was left ramped for 6 hours at the Flinders Medical Centre. With your leave, sir, and the House, I explain.
Leave is sought. Is leave granted? Is leave granted? Leave is granted. The member for Ghana.
Thank you. On Thursday, the 15th of April, the Ambulance Employees Association reported a 93-year-old patient was taken to Flinders Medical Centre after a fall. Noarlunga Hospital had previously refused to accept the patient. The elderly patient was ramped for over 6 hours. They were kept lying completely flat in spinal precautions on a hard ambulance stretcher, which is not designed for long-term use by elderly patients who are at high risk of pressure injuries. The patient could not drink or toilet properly over those over 6 hours.
The Minister for Education. Order. 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 Members on my left. The member for Playford will leave for 20 minutes in accordance with Standing Order 137A. The Minister for Education has the call. The Minister for Education.
Thank the member for the question. Obviously, he's asked a question in relation to a serious incident, and I will seek further information. I do note indeed that in relation to the Flinders Medical Centre Emergency Department waiting room, when the member was indeed the advisor for health, a series of events took place described in the former minister's book, which I'm sure the member has...
Order. Order. Members on my left. The member for Ghana. Order. The Minister for Education will resume his seat for a moment. Members on my left and members on my right. I'm endeavouring to listen to the answer of the Minister for Education. The Minister has the call. The Minister.
Yeah, we do take this very seriously, sir, and indeed the crocodile tears of those opposite when they start laughing and shouting at a serious answer. Oh, at me, yes, indeed. That's incredibly grown-up behaviour by members of Parliament pretending to serve communities. The fact is that the former Minister for Health, John Hill, described in the book, in the words that were read by the Premier earlier today, the flawed approach that the former Labor government, of which the member was indeed the advisor for the Health Minister, before I think he was the Chief of Staff for the Health Minister, before he was the Assistant Minister for Health, who was involved in transforming health, who delivered transforming health, also delivered a health facility that was designed in such a way that it required infrastructure improvements that are indeed being invested in by this government and fixing the problems that were created under the former government. Now, if in addition to the structural failures of the building as was designed by those opposite, there are further contexts and matters that are relevant to this particular case, then I will bring back further information for the House.
Order. Before I call the member for Chafee, I call to order the member for Cheltenham. I call to order the member for Ramsey. The member for Chafee.
Sir, a question to the Minister for Trade and Investment. Can the Minister update the House on how the Marshall Liberal government is working with the South Australian wine industry to create jobs here in South Australia?
The Minister for Trade and Investment.
Well, I thank the member for Chafee, and of course his electorate takes in the Riverland, which is a very important wine region in South Australia, helps contribute over $1.9 billion to our economy. So, of course, your region is very important. Of course, that wine industry has been impacted of late, whether it's the bushfires or COVID with international travel restrictions, or, of course, more recently, market access issues into some of our key markets, principally into China, where just recently tariffs of over 200% were announced for a period of 5 years, and of course that caused major concern. And we, as a government, are taking this very seriously. Since becoming the minister, I've worked closely with the industry because we know we have to work with the industry to solve these challenges. We have to work with the federal government to partner with them to assist them moving forward, because of course they know the solutions better than government does as well. So, as I said, in recent months we've been holding industry roundtables with not only regional associations, with state bodies and also national bodies as well, ready to understand, what the response should look like, what are the support requirements for that they have. And of course, I'd like to thank them for their input. There's a lot of time spent there and they gave some great insights. And one of those key messages they said, of course, is that while it'll be extremely difficult, the only real solution when there are market access issues and challenges is to expand into other markets. It won't be easy, of course, but we're ready to work hand in glove with them to help them achieve that. We've tried to. Previously, I've spoken in Parliament how we can assist, with the local domestic sales. We've run the I Choose SA wine campaign, very successful, and also our trade officers in our key markets are doing fantastic work there. But of course, as I said, helping these wine makers expand into other markets and diversify is hugely important. That's why it was fantastic when very recently at McLaren Vale, one of our key wine regions, the Premier announced the Marshall Government's Wine Export Recovery and Expansion Program. That's a $5.4 million commitment from the government over the next 4 years to help support our South Australian wine exporters and also help support them because we know that'll grow local jobs in those areas and more principally South Australia. Of course, we're going to do that by aggressively going into existing markets principally, and of course the message is there's expanding existing markets which need to expand into. Some of those, the US and the UK, they're worth around $400 million each, and there's capacity there for them to absorb some volume into those markets. And also Canada as well, a single DEX system, the Liquor Control Board of Ontario. It's key and fundamental we work with them. Developing markets as well, there's huge opportunities there, especially in the Asian middle class. They're taking to get an appetite for South Australian wine, so whether that's Japan, whether that's South Korea, Singapore, Malaysia, and even, of course, New Zealand, our near neighbours. There's some great opportunities there. And then, of course, emerging markets where, they're just getting a taste for it. So United Arab Emirates, Western Europe, of course, and, of course, India. So how do we do that? Of course, we've got to cater for all SA wineries, whether they're large, medium or small, going into existing platforms, whether that's in the US, Wine.com, a massive e-commerce platform, the Vinio, the #1 wine app in the world, whether it's in the UK, Majestic Wines, e-commerce and retail there, and sales have certainly picked up into market. So, of course, the program starts 1st of July. It's a fantastic program. I recommend wineries get involved, and it's just one way the Marshall Government's working to support the wine industry here in SA and help support jobs.
The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. Premier, why, as of 2 p.m. today, have there been 19 patients who have been stuck in emergency departments for over 24 hours waiting for a bed? And what is being done to help these people get the care that they need right now?
The Minister for Education.
Look, I thank the member for the question. Obviously, there's an extraordinary investment that's been going on in our health system since coming to government, more than $2 billion in investment in the health system over and above what was in the budget papers previously, more than $1 billion in infrastructure. Imagine, sir, for a moment the circumstances we'd face were the Labor Party still in power and the former Treasurer, the member for West Torrens, budget settings allowed to continue. In relation to the circumstances that are confronting the hospital system today, the Premier answered at great length in the first 3 answers in question time today the circumstances in which we are facing, not just as a state, but as a country in the wake of the extraordinary disruption to the health system through the COVID-19 pandemic, with a dramatic drop in people's engagement with primary health care last year, and indeed, of course, the work that our GPs are doing as part of the vaccination program around Australia. Whether or not there is also a contribution of the situation with people with chronic disease who did not necessarily take steps as they usually would to engage with their health system last year, that's now presenting extra challenges. Now, the member identifies a particular time on a particular day, and if there are... The member has identified a particular point in time on a particular day. Yes, right now.
Order.
Usually what happens in a chamber like this is that if somebody interested in a topic asks a question and somebody seeks to provide an answer,
The
And
Minister has the
if
call.
the person
Direct
is
his
genuinely
response
interested,
to the
usually they
question.
allow that answer to complete rather than trying to score political points by shouting across the chamber. That tends to only happen when somebody is only interested in politics and not actually interested in advancing the healthcare.
Order. Order. Interjection on my left will cease. The Minister will not respond to interjections. The Minister has the call. The Minister.
Thank you, sir. I'm not upset. I'm just disappointed. The fact is that if there is further information that is necessary or relevant to the particular point in time which the member is asking about, then I'll bring back further information to the House. Should there not be any further specific information relevant to that point of time, then I refer the member to the range of previous answers that have already been given, which clearly address this situation.
Member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. How many hours were ambulances ramped, otherwise known as transfer of care delays, in each of the months of January, February, March and April this year?
The Minister for Education.
Thank you, sir. As the Minister representing the Minister for Health in the House of Assembly, I'll take that question on notice and bring back an answer to the House.
The member